Welcome to R.A.T.S, Racing Against Time for Students in Pathology. This series is intended mainly for the first year postgraduates. I hope you people shall find the introduction interesting and informative. This is R.A.T.S, and he was the person who found a number of things, including the R.A.T.S sign. In fact, it was a migratory thrombophlebitis. Thrombophlebitis is thrombosis and inflammation of the vessels. And the word pathos, in fact, means suffering. I welcome you people to the wonderful world of suffering. Let us see what this gentleman had identified. He had identified the R.A.T.S spot, R.A.T.S sign, and the R.A.T.S syndrome. The R.A.T.S sign is a migratory thrombophlebitis that could be seen in a case of a metastatic tumor. In fact, this patient was supposed to be having a pancreatic carcinoma, whereas paradoxically, R.A.T.S himself developed a gastric carcinoma and he diagnosed his death. Another gentleman whom we shall always remember, though belonging to another field, mainly medicine, he is a friend of mine. And he has described the scope of pathology as is your pathology, so is your medicine. That is the amount of importance that he has given. And this is the oscillus node that you people see in endocarditis. And he has been the center of a lot of quotations, connotations, and annotations. A person whom we shall be visiting frequently. The anatomical dissection is in fact the basis of pathology. After all, pathology is supposed to be a deviation from the normal. And as a subject, it can be fascinating, intriguing, challenging, threatening, satisfying, enchanting, humiliating, and unbeatable. What not? And this is the person Vesalius, whom we shall always adore. He was again a challenging anatomist who had displayed the structures of the human body. This is one place where we dare not to enter. The dead are teaching the living, an autopsy room as such. And this is the Grant Medical College, Mumbai, where I had my autopsy posting as a postgraduate student. A book written by a pioneer, Ludwig, Current Methods of Autopsy Practice. I would like you people to kindly register these books in your mind. Decisions can be taken later. And again, a case where the dead are teaching the living. The father of pathology, Rudolf Virchow. Germany has produced many pathologists, physicians, microbiologists, so on and so forth. And paradoxically, this man happened to have been a physician, an anthropologist, a pathologist, a historian, a biologist, a writer, editor, and whatnot. And today he is known as the father of modern pathology. And some people call him the Pope of medicine. Probably recalling, as is your pathology, so is your medicine. And what is white blood? When he was seeing a slide under the microscope, he found that there were bizarre cells in the peripheral smear, outbeating the RBCs. They were all abnormal, and he called it as white blood it turned out to be a discovery of leukemia. Close on the heels of Rudolf Virchow was Rokitansky. Karl Rokitansky. Again, these people all go hand in hand. They have contributed enormously. So much so, this is the evidence. It's a gallbladder that is showing a lot of inflammation, and there is a sinus that is dipping down into the muscle, which is called the Rokitansky-Bischoff sinus. His name can be recalled in many an instance. I hope you people can recall this particular book, a very famous novel, The Final Diagnosis by Arthur Haley, a very good novelist who has written a number of books. It is a story about a small hospital having two controversial pathologists, one young and handsome and another person, old with an unclean beard, etc. And then there is an incidence of a biopsy being taken from a softness. The junior person says it is benign, the senior person says it is malignant. There is a difference in the biopsy. This story can be telling you about the difficulty in the interpretation. The biopsy was sent to two different pathologists in different parts of the world, and the report came after some time, one benign and another malignant. Finally, the senior person took the lead and gave a diagnosis of malignancy, and an amputation was done in the thing. So it turned out to be as this. So this is the amputated lower end of the femur, and it is showing a tumor. This is the epiphyseal plate, but it is encroaching or infiltrating into the surrounding tissues. And radiologically also, you people would have heard of the Scodman's triangle. What I'm trying to say is there is a difficulty in the interpretation, decisions will have to be taken, and radiology, pathology, and clinical medicine may sometimes go hand in hand. If only pathology was as simple as this. I'm seeing a slide in which there are a couple of nuclei. The pink ones are the eosinophilic nucleoli. Okay, a mirror image, and we can diagnose it as a Hodgkin's. And this is the age-old microscope. But today, we are being armored with a lot of these gadgets, which are having advanced techniques in them. A binocular, a trinocular rather, for provision of a camera. So this can be used for multi-purposes. Is technology a boon or a bane for pathology? So on the one hand, I'm finding, can you people recollect what it is? Yes, it is an electron microscope. There are two types of this. One is a scanning electron microscope and another transmission electron microscope. Whatever is being visualized is fed out to a computer screen where it is being recorded. And this incidentally happens to be the racket-shaped structures that we see as Bieberg granules. The eyes do not see what the mind does not know. In fact, what is more important than the eyes is what is behind the eyes. And I hope this particular structure can be identified. If not so, you just keep it under the microscope, you find the RBCs moving around, and it is a case of a wet mount in a case of a filariasis. And whenever we talk of the site laboratory, I would advise you people to kindly go to such manuals. Monica Chisborough has done a wonderful work in compiling 2 books for tropical countries. It is quite expensive now. If you can find out an ELB edition, it is lucky for you. And look at the extremes over here. In this, I'm finding probably a special stain and then a tissue. Here, I'm not able to understand much except that there is a helix. So, pathology today varies from microscopic to molecular techniques. So, such is the range, and how we are going to prepare ourselves for that is $1 million question. A couple of people over here. One is R.A.T.S. and Thomas Hodgkin. Thomas Hodgkin, after whom the Hodgkin's disease is being named. And Dorothy Reed is the person who had identified these cells. And then the diagnosis of Hodgkin's lymphoma came. But again, we find that there are too many challenges. In the sense, controversies are part of pathology. This kind of cells we can see in a number of conditions. One is a Hodgkin's disease, another can be a non-Hodgkin's disease, third can be an infectious mononucleosis. But the problem with us is we have to give the final diagnosis. So please do remember Reed and Hodgkin. Again, the story of the dead teaching the living. This particular one, it is a slice of an entire lung. This slice can be found in the Museum of Gypmum. This is called the Guff Wentworth section, and with a microtome, the entire slice of lung has been cut and it has been mounted. Useful for diagnosing conditions such as emphysema. But then, amazing. See how it is being stored. This is one particular place where you people shall visit, revisit, and keep visiting. It is a temple of knowledge for you. Today, you do not see cases of a peptic ulcer, a gastrectomy specimen. You do not see a lobectomy specimen of a pulmonary pneumonia, or you do not see an aneurysm. Those days are all gone because the diseases are diagnosed early and the complete output is not there. Therefore, the museum is a place where the dead are teaching the living. An amazing one, and the place is Imperial College, London. Lots of places have got wonderful museums. I would like you people to kindly visit them on the net at least. Ackerman, a Laurel, and we call him as Lauren Ackerman. And today this is supposed to be one of the Bibles to be read by the postgraduate. Not read, referred, and kept. Do not download such books. Kindly have one good book with you people. When the eyes fail to see, so that is the antigen and antibody. Sometimes we make a diagnosis on histology, but when we do fail, we search for the particular tumor antigen and then try to identify them using the appropriate monoclonal antibodies. And this is what we call as immunohistochemistry, used in the diagnosis of specific tumors. Robin Warren, the Australian pathologist. And see what he had diagnosed. This is the Helicobacter pylori, for which he was awarded the Nobel Prize, associated with gastritis, gastric carcinoma, so on and so forth. In fact, this has come as a question in the recent past. And there are different special strains which can be done to identify this organism. This is my wonderful college, and still I'm happy that there is the banyan tree. So, Virudigal, that is how it is being called, Kilpauk Medical College. And this is another place where I had worked for some time, Jippa. Really, zones of knowledge. And when I do something for the students, there is always a record of it. These are the channels that I run. One is GAME, Gross and Microscopy Explained. Another is R.A.T.S, Racing Against Time for students in hematology or pathology. And of late, I have started recent advances for postgraduates. So these are the various ones. You people have got free access to it. Go to either R.A.T.S or GAME and you will be able to identify them. A good book is a precious lifeblood of a master spirit, Stanley Robbins. And this has stood the test of time. Here is an edition that we people see. The second edition of Robbins was what I used. But now we have gone into the latest of editions. I would advise you people not to venture beyond the 8th edition because it will be more complex so that you will not be able to understand. Basics are basics. You should be strong in that. And another one, Otto Sapphire. It is a book for autopsy, gives us immense amount of knowledge and information. For example, the granular contracted kidney, what is the differential diagnosis? The types of ulcers, how do you differentiate? What are the methods of opening the heart? The Ludwig that I had mentioned earlier, an R.A.T.S affair, shall be a must-have in your armamentarium. This is the place that I traverse almost every day. From my house to my college, I pass through this. And there is a sense of sullenness, despondence, hopelessness that is always there. A sense of quiet and people having a desperation stand outside. And this is the lady who has been managing it for nearly a half a century. And look at the respect that the Prime Minister has got for Dr. Shanta. So this is something. A tree that I am seeing over here, the logs are being cut, from which I will be able to get a kind of a staining. The hematoxylin stain, the blue color, is from the tree. And the tree is called as hematoxylin camphibon. So unfortunately, we are now going into a bit of automation so that we do not know much of the techniques. And regarding the techniques, there are again beautiful books. Culling is one of the earliest ones, ancient ones that has stood the test of time. And look at this one, there is absolutely no comparison, a recent microtome that is used for cutting thin sections. So hematoxylin camphiclanum is the one. But then this is a saying from Robbins itself. When you go too near the trees, you will be losing track of the woods. So this is the woods that I'm seeing. But when I go too near it, I will be losing an entire vision of it. Therefore, it is better that you people have a holistic approach towards the subject, towards the patient, towards the specimen, and towards the organ system. Subjectivity matters. So we had seen about the final diagnosis, and this is a slide of the osteogenic sarcoma. What is the subjectivity? It varies from person to person. That is how it is called. So this variation, of course, is supposed to be the challenge in pathology. If you are going to see one or two normal structures in the bone and cartilage, you will be having myriads of pictures as tumors and non-neoplastic lesions. Multiple permutation combinations. Pathology has got no end. Dear students, there is a small secret in this. We all should have a sense of belonging to the place that teaches us. In fact, what we are seeing on the screen is my SRM Medical College, Hospital and Research Center, where I had been for the past 18 years. This sense of belonging is of paramount importance, where you will be spending the major part of the work as well as your life. And this shall be the most important foundation for you people. Thank you for your patient listening. See you for the next cup.